Congress called the SNAP provision savings and reform. But the money does not simply disappear. Federal food assistance falls, Oklahoma inherits new costs, and families face tighter eligibility rules. The tax benefits were advertised immediately. The largest nutrition consequences were placed on a slower fuse. This is the SNAP shell game. Washington claims the savings and Oklahoma gets the bill. Oklahoma's 5 Republican House members and Senator James Lankford supported the final bill. Their public explanations differed. Some denied that Medicaid was being cut. Some called the reductions reform. Others emphasized taxes, border security, agriculture, or energy while saying little about SNAP. The labels differed, but all 6 helped pass the same law. The Congressional Budget Office estimates that the law reduces federal SNAP spending by nearly $187 billion over 10 years. It also projects about 2.4 million fewer participants in an average month. Those savings come from fewer people receiving assistance, lower benefits for some families, slower future benefit growth, and costs shifted onto the states. The sequence matters. The law was signed in July 2025, but the largest state costs were delayed. Eligibility restrictions began affecting households first. Oklahoma's administrative bill rises in October 2026. The much larger benefit cost transfer can begin in October 2027. Voters heard about the tax provisions long before state taxpayers saw the invoice. Beginning October 1, 2026, the federal share of SNAP administrative costs falls from 50% to 25%. Oklahoma must pay the remaining 75%. Oklahoma Human Services requested about $25.5 million in additional state funding. That money operates the program. It does not buy one additional bag of groceries. The federal government has historically paid the full cost of SNAP food benefits. Beginning in October 2027, states with higher payment error rates must pay part of those benefits. Oklahoma's fiscal year 2025 rate was 11.04%. If that rate controls, the state falls into the 15% bracket, an estimated cost of about $220 million a year. The payment error rate is often described as though it were a fraud rate. It is not. USDA says it includes both overpayments and underpayments, along with state processing mistakes and household reporting errors. Oklahoma should improve accuracy and prosecute intentional fraud. But it is misleading to suggest that 11% of SNAP recipients cheated the government. Oklahoma entered this law with a food insecurity rate of 16.9%, well above the national figure. Cutting SNAP does not eliminate hunger. It shifts the burden to food banks, churches, schools, clinics, hospitals, and family budgets. The federal ledger may improve while the same need becomes more expensive somewhere else. Oklahoma's 1st congressional district is wealthier than the statewide average, but it is not free from hardship. More than 101,000 residents live below the poverty line, and the district includes about 40,000 veterans. When food benefits fall, Tulsa area grocers lose sales, food banks face more demand, and families have less money for rent, utilities, and medicine. SNAP is not merely a transfer payment. Nutrition affects pregnancy, childhood brain development, school performance, chronic disease, and future earnings. Saving money by reducing a child's groceries can produce larger costs later through poorer health, weaker educational outcomes, and lower productivity. Food assistance is also an investment in Oklahoma's future workforce. Richard Nixon did not create the food stamp program, but his administration greatly expanded it. In 1969, he told Congress that hunger in an affluent country was embarrassing and intolerable, and that a proper diet was a basic determinant of health. That was a Republican argument based on morality, public health, and national self-interest, not a rejection of personal responsibility. This is the central contradiction. The reductions were described as misinformation, fearmongering, and made-up claims. Yet supporters also celebrated historic spending reductions and major entitlement reform. Both cannot be true. The money was not saved by magic. It came from reduced federal spending, tighter eligibility, fewer participants, and costs shifted to the states. These are not partisan trick questions. They are basic accountability questions. Did Oklahoma's delegation know the potential state cost before voting? Where should Oklahoma find the money? How many people did they expect to lose assistance? Will they support delaying or repealing the cost shift? And will they clearly distinguish administrative payment errors from intentional fraud? Congress did not eliminate the cost of hunger. It moved the cost from the federal budget to Oklahoma and from government spreadsheets into grocery budgets, food banks, classrooms, clinics, and hospitals. Earlier Republican leaders understood that adequate nutrition was both a moral obligation and a public investment. Today's delegation should explain why Oklahoma families were not told the full price before the vote.